Hello friends, the topic of today's class is immunization schedule. So this immunization schedule is definitely everywhere and we can read it from anywhere. But what is special about today's class is that I will tell you how to remember the immunization schedule. So before we move on, let's first see what is immunization. So immunization is the process of making a person resistant to disease by giving them vaccine. So what are we learning in immunization schedule? It is when we have to give a particular vaccine. Now all of you know that the vaccines are of different types. It could be live vaccine, it could be killed vaccine and other kinds of vaccine. So they cannot be given together. There is protocol for giving every vaccine. Okay. So not going into the depth of the protocol, we will just focus on what the immunization schedule is. So, as we are preparing for NCLEX, what is important for us? These three countries, USA, Canada, and Australia. We need to know the immunization schedule of these three countries because this is what is asked in the NCLEX examination. In addition to it, we will be reading about India's immunization schedule as well. Okay, so now before we begin seeing what is the actual immunization schedule, I want you to remember a small mnemonic. Now, see. So can you see it on your screen? Hero, he, DP, pay, mila. Okay. So how is this mnemonic going to help you? So these are the names of the vaccines. What is HE? It is hepatitis B. What is RO? Rotavirus. Next is your HI. HI would be your H influenza, right? DP is your usual diphtheria and tetanus. Another P is your polio. And the last M is your meningococcus. So, see, D was for diphtheria pertussis tetanus, DPT. P is your here pneumococcal vaccine, right? So, now we have learned this mnemonic hero, he, DP, pay, mila. Okay. So now we have the names of the vaccines which correspond to it. Now I'll tell you why this mnemonic is important. See, when you see the immunization schedule at 2 months, 4 months, 6 months, all these vaccines are used. Okay, so now if you have it clumped together, it will be easy for you to remember in the examination that which vaccines were there for this particular month. Now, having learned it, let's see what the immunization schedule says. So let's talk about USA first of all. At birth, hepatitis B1 vaccine is given, right? Only hepatitis B1. See, birth is very important. The kind of questions that you're going to get in your examination will be a mother has just given birth. What vaccines will you advise for the advise the mother to have the baby vaccinated with? Okay, so you need to know at birth what are the vaccines that are given. So as you can see in this table, in USA, hepatitis B1 vaccine is given at birth. No other vaccine is given. Okay. Similarly, in Australia also, hepatitis B1 vaccine is given. In Canada, no vaccine is given at birth. You have to remember this. So if a question comes that you're practicing in Canada and you have to advise the mother regarding the vaccination, you have to remember that at birth, no vaccine has to be given if you're in Canada. Okay. Now, coming back to USA. First was hepatitis B1 at the time of birth. Now, how is this schedule working? One vaccine has been given at birth, the next will be at 2 months, then 4 months, then 6 months, and after 6 months, it will be in 12 months. 12 months and 18 months. So after 6 months, there will be a gap of 6 months. So 6 months, 12 months, 18 months, and after that, straight away 4 to 6 years. Okay, so this time gap you have to remember. The initial vaccines that are given, they are given at an interval of 2 months. After 6 months, it is given at an interval of 6 months, and after 18 months, it is directly given at 4 to 6 years uh, or later like 9 to 13 years depending upon which country we are talking about. Okay, so coming back to USA. So the next is the vaccines that are to be given at 2 months of age. So at 2 months, can you see, here is our mnemonic. Hero, he, ro, he, D, P, P. So meningococcal vaccine is not there for USA. Meningococcal vaccine as of now is not there in USA. Okay, so Mila you can remove. The rest of the vaccines you have to give in USA depending upon which month. So at 2 months all these vaccines are to be given. Again at 4 months hepatitis B is removed. At 2 months there is, I'll write hepatitis B here and I'll cut it so that you remember that hepatitis B is not to be given at 2 months. Okay. So this is, see, this is the table that you have to visualize and remember. Otherwise, it is very difficult to recall it in the examinations. Okay, so hepatitis B is not there in the 4th month. Again, at 6 months, rest of the vaccines are there, but hepatitis B is not there. Coming to 12 month. At 12 months, only hepatitis B is given and pneumococcal vaccine is given. And there is slight difference in the timing of pneumococcal vaccine. So we are saying here that it is given at 12 months. So you can roughly remember it as 12 months, but it is given anywhere between 12 to 15 months. What is the kind of question that will be asked? The question will be asked that a previously vaccinated a previously vaccinated child has come to your clinic and is of 14 months of age. So what is the vaccine that you are going to administer to him now? So it is not specifically 12 months. It is anywhere between 12 months to 15 months where you can give this pneumococcal vaccine. This you have to remember. I'll just make a star here. At 18 months of age, DTP is given. DTP 4th dose. And again at 4 to 6 years, DTP dose 5 is given and a polio vaccine is given along with it. So what is the pattern that you have to remember? See, the mnemonic that we had, remember, it was applicable for 2, 4 and 6 months. Okay, without the M, without the meningococcal vaccine. So meningococcal vaccine is not there anywhere in the US schedule. This you have to remember. Okay, for 12 months, at 12 months, only 2 vaccines are given. What is it? It is H influenza B vaccine and pneumococcal vaccine, which can be given at 12 to 15 months of age. Next, at 18 months, you have to give the DTP dose 4. And at 4 to 6 years, again, a DTP dose, which is DTP 5. And along with it, one polio dose has to be given. So this you have to remember. Okay, now coming to the next country, which is Canada. So we have already talked about that at birth, no vaccine has to be given if you're there in Canada. Okay, now what are the next? So can you see, this is starting with the hero is removed here. There is no hero in Canada. Okay, so our hero part is removed. We are starting with he, D, P, P, Mila. The entire mnemonic is right here. Okay, so H influenza B vaccine, DTP vaccine, polio, pneumonia and meningococcal vaccine. Okay, now again, for 2 months it is the same, for 4 months it is the same, and for 6 months it is the same. Now these are done. Okay, after that DTP's booster dose is given at 18 months and another booster is given at 4 to 6 years. So this you can corroborate with USA also, that DTP 4 and 5 dose is given at 18 months and at the age of 4 to 6 years, right? So for the first three, that is 2 months, 4 months and 6 months, our mnemonic is corresponding here. So you can remember that these are the set of vaccines that are given at these three time points. Now at 12 months, now this 12 months is completely different for Canada. So what is MMR? Mumps, measles, rubella. Okay, so either MMR vaccine is given or VAR, VAR. What is VAR? VAR is for varicella vaccine. So MMR is given or varicella is given, and additional pneumococcal vaccine is given, which was there at 2, 4 and 6 months also. Okay, so this you have to remember, MMR, VAR and pneumococcal, all these are given at 12 months of age in Canada. Now coming to 18 months. 18 months we've seen already that DTP booster dose is given. Apart from that, polio, H influenza B and MMR vaccines are given. Okay. So this is DPHM. DPHM. This you have to remember for 18th month of age in Canada. So DTP you already know. H influenza we were given for the first three time slots at 2 months, 4 months and 6 months. The next it is given at 18 months of age. Right? The same goes for polio. And MMR vaccine, we are giving 2 doses of MMR vaccines. So MMR you have to give at 12 months and 18 months of age. Right? And at 4 to 6, we have seen that DTP and polio is to be given in Canada. Right? So Canada is clear. Let's revise it once. At birth, nothing has to be given in Canada. Then at 2 months, 4 months, 6 months, our mnemonic is there. We'll remove the hero. Rest of the mnemonic will be placed at 2 months, 4 months and 6 months. That those vaccines will be given. Then coming to 12 months, 12 months is slightly different for Canada. What is given? MMR, VAR and a pneumococcal vaccine, right? So for 12, it is very different. So you have to visualize this table, otherwise you will not be able to remember. So MMR, VAR and pneumococcal vaccine is given at 12 months of age. And then at 18 months, what are we giving? It is DPHM. We are giving diphtheria, DTaP, we are giving DTaP, we are giving polio, H influenza B, and we are giving MMR vaccine. This you have to remember. And at 4 to 6, again DTP and IPV we are giving, both the polio vaccine we are giving. Okay, so this is about Canada. Now coming to Australia. So in Australia, again at birth we are giving hepatitis B. Here, can you see it is starting from row? It is starting from row and the HI is not here. Okay. So we are giving rotavirus, DTP, pneumococcal vaccine and meningococcal vaccine. So what are the vaccines which are missing here? The H influenza vaccine and the polio vaccine is missing in Australia. Okay. So from our mnemonic, H influenza B and polio vaccine are missing. Again, so, but it is easier to remember how, because when you see what is missing, the rest of the things are given at 2 months, 4 months and 6 months. In each of the countries, it is not changing for the 2 months, 4 months and 6 months schedule, time slot. Okay. So now you know that rotavirus, DTP, meningococcal vaccine and pneumococcal vaccine are given at 2 months, 4 months, 6 months. Now let's see, this is 2 months, this is 4 months, this is 6 months. Now this is 12 months. Let's see what is there in 12 months. So meningococcal vaccine and pneumococcal we were already giving. What is the difference here? Till 6 months of age we were giving meningococcal B vaccine. Meningococcal B vaccine we were giving. At 12 months of age, meningococcal ACWY vaccine is given. What is ACWY? So see, meningococcal B, when we said, it was the B serogroup of meningococcus. So similarly, there are other serogroups out of which A, C, W and Y vaccines combined together in meningococcal ACWY vaccine, which is given at 12 months of age in Australia, right? At 18 months, can you see that DTP, MMR, and H influenza B are same as Canada? So this you're giving D, you're giving H, and you're giving M. But there is another vaccine, the hepatitis A vaccine, which you're giving in Australia at 18 months of age. Okay, so this is a new addition. See, the questions, mostly if they are asked in the exception cases, this is one of the kind of question that will be asked. So at 18 months of age, there is a new vaccine. Hepatitis A we have not read till now. Hepatitis A vaccine is here given in Australia at the age of 18 months. This you have to remember. Okay. And then at 4 to 6 years of age, 4 to 6 years, what is given? DTP, hepatitis A, again the hepatitis A second dose, and pneumococcal vaccine. Okay, so it is not very hard to remember. See, we'll go about Australia once again. So you can see at birth, hepatitis B1 vaccine was given, which was same as the USA regime. Okay, now coming to 2, 4 and 6 months. At 2, 4 and 6 months, we have removed the polio vaccine and we have removed the H influenza B vaccine. Rest of the vaccines in the mnemonic, which is rotavirus, DTP, pneumococcal, meningococcal, all these vaccines are given at 2, 4 and 6 months of age. Then coming to 12, what is the difference in the 12? We have seen that meningococcal B vaccine was given in the previous doses. At 12 months of age, it is meningococcal ACWY. The other serogroups are given at 12 months of age. With meningococcal, what are the other vaccines that we are giving? We are giving MMR, we are giving pneumococcal, and we are giving meningococcal B as well. So the B is being continued. ACWY has been added. Okay, so this is for the 12th month. And for 18 months, what are we given for 18 months of age? The DHM, as was being given in the Canada regime, it is same. So it is DTP, H influenza B, and MMR. These vaccines are given, and apart from that, a new vaccine, hepatitis A, is being given in Australia at 18 months of age. Okay, now at 4 to 6 years of age, DTP, hepatitis A, and pneumococcal vaccine is given. So DTP and hepatitis A just as 18 months of age, additional is your pneumococcal vaccine. Okay, so this is the general immunization schedule which is applying to all of them. Apart from that, what you need to know, for USA, they have started the COVID vaccine. They have started COVID vaccine. So what is the dose of COVID vaccine? One dose is given, like they say that at least one dose has to be given between 6 months to 4 years of age. Okay, 6 months to 4 years of age. Right, this is your USA. Another thing that is given is, since MMR was not here in our schedule, MMR is given in 2 doses. The first dose is given at 12 to 15 months along with your pneumococcal vaccine, and the second dose is given at 4 to 6 years, right? At 4 to 6 years here along with DTP5 and polio vaccine. So MMR you have to remember separately for this. Okay, now hepatitis A is also given in USA. And what is the dose? It is given at 12 to 24 months of age. 12 to 24 months of age is the time when you give the hepatitis A vaccine in USA. And how it is given? If the first dose is given at 12 months, the next dose will be given 6 months later. So between 12 to 24 months, 2 doses have to be given, each dose 6 months apart. 6 months apart, this you have to remember, right? So these are the total vaccines for USA, right? Now coming to Canada. So Canada, apart from all these vaccines, not hepatitis, HPV vaccine is given to females of 9 to 13 years of age, single dose. HPV vaccine, 9 to 13 years of age, only female candidates, right? And we have seen in Canada this 4 to 6 years, apart from this 4 to 6 years, this DTP dose and meningococcal dose is given at 14 to 16 years. See, I'll write just here only the DTP and meningococcal is given. DTP and meningococcal is given at 14 to 16 years of age. Right? So this is the additional vaccine that you have to remember. One is HPV. HPV is given at 9 to 13 years of age, and the other is DTP and meningococcal vaccine. It is given at 14 to 16 years of age. These are the two extra vaccines in Canada that you have to remember. Okay, now for Australia, in Australia again at 12 to 13 years of age, HPV is given. HPV vaccine at 12 to 13 years of age, right? And another is this meningococcal ACWY. We've given just one vaccine, so the other one is given at 14 to 16 years of age. Meningo ACWY is given at 14 to 16 years of age, right? So it's not very hard to remember. See, we have meningococcal ACWY given at 14 to 16 years of age and HPV at 12 to 13 years of age. So now we know that if HPV is in the question, so in USA, in Canada, this HPV is given at 9 to 13 years of age, and in Australia, it is given at 14 to at 12 to 13 years of age. So roughly, you have to remember that at 13 years of age, your HPV vaccine will be given. Okay, and then the other ones are the booster dose. So now we have seen what all vaccines are given and at what time they are given. Now another important aspect of vaccine is what is the route of administration of these vaccines. So route of administration is again very easy to remember. I'll tell you how. So here we have the route of administration written on your screen. So this route of administration, see, if you want to make a fluke, if you want to guess, you put a tick on IM because most of the vaccines are given by intramuscular route, right? What are the other routes of administration? So we see the injectable polio vaccine. It is either given IM or it is given subcutaneously. This you have to remember. See, these are the only exceptions that you have to remember. So IPV can be given subcutaneous. Again, measles can be given subcutaneously, right? Rotavirus and OPV is given as oral vaccines. BCG is given intradermally. Rest all I've already told you is given as IM. So if you just remember this much, one question can be solved because one question will definitely be asked from route of administration or like it will be a long question where they will be asking that you have received a kid, he has received these vaccinations earlier. Now, what is the next vaccine that will be given and what will be the route of administration of that vaccine? Okay, so all this you have to remember. Now, like we have covered the NCLEX part of it, we'll just shortly see what is the immunization schedule in India. Okay, so at birth, here you have to remember 3 vaccines are given at birth in India. Okay, what are these vaccines? The first is your oral polio vaccine. Oral polio vaccine, the 2 drops that are given that you have to remember. Next is your BCG vaccine. What is BCG vaccine for? For the protection from tuberculosis. So since we know that in India tuberculosis is very prevalent, so the BCG vaccine is given immediately at birth to protect the child from the surrounding infection. Okay, so BCG and OPV is done. Hepatitis B, you have seen that hepatitis B is given in USA also and in Australia also, both at birth. So in India also hepatitis B vaccine is given at birth. Now the schedule is slightly different. We have seen for the other countries it was 2 months, 4 months, 6 months, 12 months, 18 months. In India, it is starting from 6 weeks. That is your 1.5 months. It is starting slightly earlier. Okay. So at 6 week, what are we giving? We are giving pentavalent vaccine. We are giving OPV, rotavirus, IPV, and pneumococcal vaccine. What is there in your pentavalent vaccine? Your pentavalent has DTP, diphtheria, tetanus, pertussis, and apart from that, it has your hepatitis B, the usual, and it has your H influenza B vaccine. Right? So these 5 vaccines are present in your pentavalent. Can you relate that it is similar to the mnemonic that we have created? So for India also, things have not changed. Pretty much the same schedule is being followed. Just the time slot is slightly different. So at 6 weeks, we can see that Penta, OPV, rotavirus, IPV and pneumococcal vaccine is being given. At 10 weeks, Penta, rotavirus and OPV. Then at 14 weeks, Penta, OPV, rotavirus, IPV and pneumococcal. Exactly same what was given in given at 6 weeks. At 10 weeks, only the pneumococcal vaccine was not there. Rest the schedule was same. Then at 12 months of age, measles, rubella is given. Apart from that, PCV, vitamin A, IPV and Japanese encephalitis vaccine can be given if required. If required, Japanese encephalitis vaccine is not given routinely to all the children, but it can be given. So measles, rubella is given, PCV is given, vitamin A is given. Now, how do you give vitamin A? So the first dose of vitamin A is given at, see here we have written vitamin A with 12 months. Okay, so the actual timing when it is given is 9 months. So the first dose is given at 9 months. The second dose is given anywhere between 16 to 24 months, and this is followed by one dose every 6 months up to 5 years of age. Okay, so for vitamin A, you have to remember it separately. What happens with vitamin A? The first dose is given at 9 months. The second dose is given anywhere between 16 to 24 months. The next dose is given uh, at 6 months of interval, like every 6 months up to the age of 5 years. Okay, so this you have to remember about vitamin A. Now coming to 18 months, your 18 months here is corresponding to 16 to 24 months of age. Okay, so DPT booster is given, OPV booster is given, Japanese encephalitis, again measles, rubella and vitamin A. Vitamin A I have already told you. DPT and OPV booster, you have to remember that it is given at 16 to 24 months of age. So you can see that DPT was given at your 6, 10 and 14. OPV was given at your 6, 10 and 14, and now their boosters are being given at 16 and 20, 16 to 24 months of age. Okay, and at 4 to 6 years of age, DPT second booster is given, right? So for India, again the immunization schedule is roughly similar to what the other countries are having. What the slight differences were there that I have told you. Again, the route of administration for all of them remains same for any country, right? So this is all about the immunization schedule. This is the table that if you remember, then any questions asked from this table from immunization, you can crack it from this table itself. Okay, thank you.